So Ballincollig Primary Care Centre is a state-of-the-art facility. The population of Network 12 is over 70,000 and it services this population. I've met people on the corridors and they are delighted with this facility. It means that they don't have to go through city traffic and the ease of access, very good parking facilities. It's a very positive experience for people and for the staff themselves. It would uplift you when you come into this building, see the brightness of the corridors, and it's a hub of activity now. There could be up to 500 footprint of service users coming in any given day.
There's 3 practices in the Ballincollig Primary Care Centre, 2 on the ground floor and 1 on the top floor. The GP on the top floor is a Polish GP, Dr. Bo, and we've 2 multi-doctor practices on the ground floor. The patients love coming into a new building. I think it shows them that, you know, we have respect for them. It shows them that we're willing to put financial investment into their care. And I think once they come in, and again, like, it's intimidating for older patients initially coming to a new building. You know, patients don't really like change at the start, but I think when they've come into this building, seeing how the building has been developed and seeing how easy it is to access, you can see yourself that there's lots of signage and all this to make things very easy for people. So I think once they've been in here, they really love it.
The purpose of our outreach clinic is to provide antenatal care for our low-risk mums and pregnant mums. So it saves them travelling into the Cork University Maternity Hospital, less stress for them, they're low-risk mums. Their care is looked after by midwives throughout their whole pregnancy until they are ready to actually go into labour in CUMH. Women love it. They travel from either locally in the outreach clinic here in Ballincollig, or they travel up from Kerry or West Cork, plus they have continuity of care, which they love.
So here in Ballincollig Primary Care Centre, we're very lucky with our facilities. We have a large on-site clinic where we see our outpatients. We also have an on-site gym, and in the gym we are lucky to have machines such as cable machine, weights, recumbent bike, and we use this facility to help improve people's strength and optimise their function. And from a personal point of view, I really enjoy working here. I think we have a great team here in Ballincollig. Our physio team, we have a wealth of experience and knowledge and great camaraderie within the team. So it's a very enjoyable place to work. We're also part of a big multidisciplinary team as well. And again, we're very lucky that most of this team is under the one roof. So it eases communication. We're able to chat to each other, talk through any challenges, either in working with patients and ultimately provide a better service for clients.
So the CUMH stands for Cork Adult ADHD Tertiary Care Hub. So we have a senior OT, senior psychologist, clinical nurse specialist and a psychiatrist on the team. We aim to assess kind of, I suppose, 6 new patients per week, but then when we would have a lot of patients in the service already who might be attending groups or one-to-one sessions with myself for psychology or nursing. They're reviewed medically throughout their time on the team. It's a kind of a short-term service. I suppose the expectation is that we'd hold people for maybe 6 months and then they would be referred back to the community. We've loads of space. It's fantastic for running our groups for ADHD. I think, you know, our service users are always commenting on what a lovely building it is.
I think it's very clean, very spacious, there's a lot of light, and personally something I really like about this building is that it's near the Ballincollig Park, so our patients on Thursdays would go on a walk around the park, and I think that's lovely and they really appreciate that. Yeah, having buildings that are closer to the patients, I think it's important for any kind of patients, but to patients that suffer from the mental health especially. I know that going to a hospital can be very stressful, going to a city can be very stressful, so having these lovely buildings near our patients, I think that is very important.
It's a great opportunity to meet with other multidisciplinary team members and other health and social care professionals who work in the same building under one roof. So it gives a great opportunity to discuss about the client's needs and their progress. It saves a lot of time, and the therapist can act promptly and to provide a right service and right care and right time and right place.
I work with both adults and children, and I see a lot of different diseases and conditions. For example, you know, weight management, faltering growth, food allergies, high cholesterol, and cancer as well. It's working really, really good. We've lots of different facilities here. For the dietitians, we have 2 clinic rooms, and we also have a dietetic storage room, and we also have access to printing services and a canteen, and there's parking on site as well, which makes things easier. I get on great with all the different specialities here. It's a really great environment to work. You know, there's a massive, I suppose, multidisciplinary team here, and everyone's very, very friendly.
So my base here in the primary care centre is fantastic because I've come from a small little rural health centre where there was only myself and one other public health nurse there. So it's fantastic here to have the camaraderie and the nursing team around me. Well, I think it's really benefited the clients, especially the elderly clients, because we're now here with the other disciplines, with the physiotherapists, the occupational therapists, social workers, whom we work very closely with. It has become much easier to communicate with them. This in turn provides quite timely and effective provision of healthcare to the clients at home.
So we were successful in sourcing a grant of €1,000 this year through the Wellness at Work initiative, and we were able to organise some yoga classes. We had full classes every week. And it almost came to the point where we had to turn people away, but thankfully we managed to get everyone in. So I just think it's great for staff morale in general, and just to create that, that positive vibe within the workplace, and to make work enjoyable and to look forward to coming to work.
I think our patients here in Network 12 are going to be very fortunate because they're going to have the primary care centre here in Ballincollig at one end where all the disciplines are together, and we're operating the clinical team meetings, and equally we're going to have the chronic disease hubs here in Westfield in Ballincollig as well. It's great to have the facilities to have our team meetings together, which we would have quite often, and to have the facilities there is great. It's bright, it's airy, it has the IT infrastructure. Everybody is happy, service users are happy, and we have a great team here in Ballincollig.